Hello everyone, I am Dr. Anuj, a general and laparoscopic surgeon, and I am trying to make some videos on clinical examination, especially on short case. So please, I am welcoming all to my today's video. In my previous video, I have described something about short case, like what is short case, what is the examination scenario, etc. And today, I will start or I will discuss that how you will prepare yourself for your short case examination, like what books you should read, what instruments you should carry, or what etiquette you should possess. So hope that video will be interesting, and I would request everyone to watch the whole video as well as comment in comment section and subscribe for further or future updates. So let's begin today's journey. A disclaimer as usual. First of all, the books. What books you should read. That is the most widely practiced or widely taught clinical examination book for surgery. For medicine, you will go for the Hutchinson's or McLeod's, but for surgery, that is the reference book. There is also another reference book for Hamilton's Bailey's Demonstration of Physical Science in Clinical Surgery. So every surgical student should carry these two books at least. Okay, I do have a good bad habit of asking questions that what is the name of the reference book of you, like what is the name of the reference book of clinical examination of surgery. So mostly students tell this, sir, it is Norman Browse. Okay, even if I ask that what is the name of reference book of surgery, they will tell this, sir, Bailey and Love. Okay, but mind it that those are name of the editors or the writers. Say, for example, the name of that Norman Browse book is The Introduction to the Symptoms and Signs of Surgical Disease. So, even your examination may start with that questions also. So, try to recall your main book or reference book name as well as the writer or editors. Here is another good book which I like very much. That is Surgical Finals. Very gist. Writings are very gist here. And if anyone want to go for the MRCs or something, they can read that doctor exams book also. Now the instrument parts. What instruments you need to carry while you enter in your wards, surgical wards, or in your examination. First of all, the stethoscope, without which doctors are not doctor actually. And the sphygmomanometers, though that is not commonly used in short case examination, but that is very commonly used in long case. The measuring tape to measure the size of a swelling, or that is the tongue depressor, or you may tell the spatula for oral cavity examination, which will be for any oral cavity lesion or even for parotid. Okay, and the wearing gloves. Okay, the gloves is essential because you need to wear gloves for examining the ulcer. Even nowadays, many teachers like to wear gloves for any examination, but mind it, to assess the temperature, you have to remove your gloves. And if you are not wearing any gloves, the main thing is you have to wash your hands prior to starting palpation, after completion of the palpation, and in between the patients. Okay. Then what next? Next is the cotton wool or that toothpicks. These are to assess the neurological features in case of diabetic mellitus patient or any neurological patients or even in traumatic neuropathy patient. You have to assess these things. And also very commonly used in surgery, that is the X-ray paper roll. Every student have to make it. Okay. And to examine the trans-illumination test for hydrocele or meningocele, that is must. And that pen torch is another must thing a surgical student should have, and the color of the torch should be good quality torch. No mobile lighting, and the color of the torch should be dark color, dark black or any other color. And there is a hammer for again neurological assessment. And then some have to carry a few white paper also for examination of the tremor in case of thyrotoxicosis patient, or even in case of liver disease, chronic liver failure or something. And these some cards also to assess the functions of interossi, which are supplied by the ulnar nerve. So any nerve lesions, in nerve lesion from and sign, in nerve lesions, you have to look for this adduction, abduction or anything. So you have to carry cards also with you. And the tuning fork to assess the vibration sensation in diabetic patient or in other senses, and some chocolates or even some toys also for your pediatric patient. If your pediatric patient cries in your examination, then you will also cry. So please bring some chocolates or toys to cool or calm the pediatric patient group. Now the dress up. Okay. So everything, a doctor should be smart, and he should be smarter than any professional, because he has to attract his patients by your smartness or her smartness, as well as he should be modest in dress up. Then the dress style should never make your patient uncomfortable or distract them. You should not wear anything that make your patient uncomfortable. Any extra makeup or extra jewelry or some colored dress which is destructive for the patients. So you should not wear these things. Then exposing your chest or midriff, even legs, are not encouraged anywhere in world. Okay, for a doctor actually. And though we prefer to wear long sleeves because that makes me more smarter, but while you are going to examine patients, try to wear short sleeves or 3/4 sleeves. Or if you are wearing a long sleeves, roll your long sleeves up away from your wrist. Otherwise, that will make dirty your cuffs. Okay, so this is good thing you should follow. And if you have got long hair, you have to tie back the ear. And if you have got to carry the jewelry, it should be simple and limited. And that's the must, that apron must be clean. Now another thing, that etiquette. A friendly smile helps to put your patient at ease. That means start, whether you may be puzzled or you may be tensed, because situation is like that. So your examination will be, you will tense that time, but you have to carry a smile, because that will start a good rapport with your patient, as well as give confidence to you. And the essential things, hand washing and cleanliness. Your apron should be clean, and you have to carry a hexisol or hand sanitizer, with small hand sanitizer with you. Though your examination center will provide you, but you have to bring small sanitizer with you also. So hand washing and cleanliness is must. So thank you for watching. I hope you have got some glimpse of my upcoming clinical examination series, and hope you guys will enjoy. And to help others, please share in your timelines, as well as please subscribe my channel also. Thank you very much. Thank you very much for watching.